Welcome everyone to our third interview in the series, and we are very fortunate to have Mr. David Izadi here with us today. So Mr. David Izadi is a consultant plastics and hand surgeon working in University Hospitals Coventry and Warwickshire. He undertook his higher surgical training in the Southwest Deanery across Bristol, Plymouth and Exeter before completing a nationally appointed advanced training interface group, so TIG fellowship in hand surgery at the Pulvertaft Hand Centre in Derby. He also completed hand surgery fellowships both in Paris and Sierra Leone, where he had hands-on experience in global surgery. He has a specialist interest in the surgical reanimation of the upper limb to help restore function following upper limb nerve injuries and upper limb spasticity in both adults and children. So thank you so much for being here with us today. So, Mr. Izadi, without further ado, we will start with the first question, which is tell me about your overseas experience to date.
Haneen and Denise, very nice to see you both, and thank you for inviting me to your talk. I think this is a great platform for educating the next generation of students and trainees on how to get involved in overseas work. I was a trainee when I got involved in overseas work, and I applied through the BSSH for the global fellowship, which is only a 1-week placement. And at the time, I didn't have much experience with this. So the application is straightforward. It's 2 pages, simple questions. And generally, they look for people who are relatively senior trainees so that they are not distracted by upcoming exams or other things like that. So I did it at the start of my hand surgery fellowship in Derby. And I thought that was a really good time. You're a relatively senior trainee. You can bring value to a team. And at the same time, you've got that hunger and energy to give people with all the learning and education you've received up to that point. The team that I went out with were organized through the BSSH. So it was a multidisciplinary team of orthopedic and plastic surgeons interested in hand surgery, as well as anaesthetists and physiotherapists. So it was a big group of us that went out. And we went to Sierra Leone to, I think it's our second city called Nakeni, towards the north of Freetown. And we spent a period just over a week there together.
What attracted you to getting involved in global surgery overseas work?
So I've wanted to do, the reason I became a plastic surgeon partly was because I wanted to provide a service for people who really didn't have many opportunities. So I've come from an immigrant background myself, and there was huge discrepancies in healthcare in settings that I'm familiar with. And it's something that drew me towards medicine, to be able to help people and provide surgery to people who don't have those opportunities. So, for example, in Sierra Leone, there's not a single plastic surgeon currently working, and that in itself, by being one of 3 plastic surgeons in the group that we went to, we bring huge opportunities to help restore form and function to people that don't have those opportunities normally. So we're in a very fortunate and powerful position to help people. And that's what really drew me to international work and overseas work. And I deliberated with when to do this. I know I've got friends of mine who went out at earlier stages in their training, so ST3, 4, 5, sometimes even in between SHO and registrar training numbers. And they got good experience, such as Mercy Ships was one person I know who did that way. And once you are interested in this world, you'll get to hear familiar names and people. You contact them, and they will then say, I'm going out with a team. You might be self-funded. You can go out there to join a group of people. And opportunities quite often arise after major disasters or I don't know, conflicts, and quite often groups of people go out to areas at that time, and students or trainees can tag along during that period. But I didn't want to be a burden to anyone, and there wasn't organizations and structures like there are now. So I decided to do it when I wasn't going to be a burden to the society or to the team I was going with, and I could actually contribute something when I was there. So that was the reason for my personal timings. Yeah.
Can I just add and just ask one quick question about that? You mentioned about going when you were quite senior. Within your team, did you have any team members who were a bit junior, who also came along with?
I think the BSSH, that was a formally organised week through the BSSH. So the rest of the members of that team were consultants. The medical team, anyway, were consultants. So no, I wasn't there. And I mentioned the reasons, I think, why the BSSH do that is so that you don't have other distractions back home. In actual fact, I did have a major distraction when I was away. I had a 1-week-old baby that I was leaving behind. So I had to get special permission from home for that. But work distractions is what they try to avoid, yeah.
That's so interesting. Mr. Izadi, whilst you were out in Sierra Leone, what did you actually get to do? Was it a lot of clinics, theatres? So what was your sort of week-to-week structure? Okay,
so it was, first bit was a bit of orientation. So we arrived, we had a little walk around the hospital where we were visiting, walked around the town, the local area that we were staying at, and just got our bearings right. The time difference wasn't huge, so that was good. And then the next day, and we could already, even on the day before we started our medical consultations, there were queues of people who were camping outside of the hospital, who had traveled from all corners of the country to come and see us. And I think the way that they advertise it locally are radio, WhatsApp groups, various things saying international medical group will be coming for these dates. But there's not, even though they try to specify what we are there to do, everybody with the problem tries to come. So there was a huge number of people who arrived, and on the first day, the clinic setting, there was a orderly queue. So in the NHS, after we're running 20 minutes late, we normally get our first complaints. There, people were waiting for days, and very disgruntled individuals in the queue. And I was very fortunate to be with an experienced group. Our group leader had been to Sierra Leone in the past, and he knew the type of patients we could offer treatment to and not leave any burden for the local healthcare system, i.e. don't take on anything that we can't see and treat, almost as a day surgery procedure type of thing. So nothing complex like free flaps or anything that we could get it wrong and then leave the patients and the team in a difficult situation. So there was a clinic setting. I think we saw over 100 patients in the first couple of days, and they ranged from what we were specializing in hand and upper limb to tropical ulcers, for example, to tumors of the head and neck that we couldn't help with because we didn't have the histology that we could get, or we wouldn't have the MDT facilities with the radiological equipment. So that was the hardest part of the clinics, was to say no to people that we couldn't help. And amazingly, they just accept it with a smile on their face, and they thank you for their time, and they go home. So that was quite challenging for me personally, but I understand the reasons why we couldn't offer surgery to everybody. And then we would meet up every evening after dinner and talk about our experience in the day. We would check in with each and individual person to see how they were doing, if they found anything emotional, because it is an emotional setting, and support each other as best as we could. And then after that, we would structure the week and say that we would break ourselves up. We had 2 anaesthetists, so we could run 2 theatres safely, and we'll break ourselves up into 2 teams and offer treatments on patients in groups, and we would work in pairs as well. So I would be paired up with another consultant and get to do what was in my skill set. So we talked about tropical ulcers, operated on patients who needed skin grafts. We talked about doing other more complex hand surgery, tendon lengthening procedures, nerve injuries, etc., etc. So there was challenges for the team, but we had the right skill mix amongst us to offer the treatments presented to us at the time, having said no to a lot of people at the same time as well. So that was for the week. So we on for the first, we operated on from day 3 to day 7 or something. And then we had any patients that were staying in for a few days, we would do a post-operative ward round every morning on them until they were discharged. And patients that were not discharged, we had a system in place that would get updates until they were discharged when we were back in the UK. And that was not very many of the patients. So they were all wound care issues that we had to just confirm the date that we were happy for them to walk, for example, after a skin graft, etc.
Was there any particular case that stood out to you that, was quite memorable, was a really good learning opportunity?
Oh, amazing case. Yeah, I can still see the boy in front of me now. So it was a young boy who had sustained. So in a lot of African countries, when it gets dark, it gets dark. You can't see anything. You don't have electricity in a lot of the villages, and cooking and preparing food is over open fires. And so you get a lot of burns and a lot of injuries from that type of setting. And a 8-year-old boy was badly burnt, and when he saw us, he had effectively overgranulation, as well as I think a fracture underneath it. I can't remember the exact details, but he was walking around holding this edematous, lymphatically swollen limb with his upper hand. So he was always walking with his other hand supported by his good hand, and he was in pain all the time, and life was difficult for him, and the decision was made to do it was not a salvageable limb, so we did a above elbow amputation on this child, and the following day he was running up to every single person on that team and hugging them. And we got balloons, and we drew the BSSH logo on it, and we were playing with this child on the ward with the balloon, and he was jumping. He had no pain anymore. He was comfortable. It was like he had given him his life back. And that is what really sticks out in these sort of trips, is how much of a difference a relatively straightforward operation in experienced hands can provide these patients.
You mentioned about there being less resources in particularly Sierra Leone or countries abroad. Have there been any learning points that from those experiences that you've then taken back and used in your day-to-day work here in the UK?
Do you know what? I think we're very fortunate where we work. We've got structures and teams around us that make our jobs both enjoyable and make it easier for us. And when you're in areas where they don't have as much of that support, you just reflect back on how fortunate you are in that situation. I think the best thing that's happened with the COVID pandemic is that freedom of education that has exploded on the scene. And places like Derby have been a shining light in this pandemic, where they've provided so many free webinars for people and offering education where to the standard that we want to be trained, other people will have access to that as well. Everyone's got a mobile phone out in Africa, so everybody can access these things, and it's a very powerful tool. What I've brought back, I guess you just reflect on what a fortunate time you had to help these people, and I don't know. I think you just end up trying to be more optimistic and give positive vibes out when you come back. But the UK has got a very good structure in place, and there's certain things that all of us would like to change, such as the rigidity and maybe too much management input, where we didn't have that overseas. But I wouldn't change that. A lot of that is for patient safety reasons, that we have to accept that this is the society that we practice in here.
Thank you so much for that. Owing to the fact that you have this societies for trainees and junior doctors, is there anything that you would give advice-wise for sort of our stage junior registrars or SHOs who are interested in getting involved in overseas work? What would you advise them? Do you think that it's actually more important to go as more of a senior trainee? And secondly, do you have any general advice for anyone interested in overseas work?
Do you know what? I think it's a very personal question. So it depends on the individual and what they want to do. If you want to go out as an observer at an early stage in your career, why not? Go and get that flavor. We all do that as medical students, don't we? So we're not doctors at that stage. So you just literally do whatever you feel you're comfortable with. I was more comfortable to do it at a later stage of my training, but I don't think it's right of me to say you shouldn't do it until that's a sort of old school preaching that I used to receive. You shouldn't go out and practice on the natives, and you have that in the back of your head, but you're not practicing on anyone. The charitable societies, they if you want to do it through those channels, and I would very much encourage you to do it through BFIRST and BSSH and organized groups, because there are so many logistical issues that you may not have thought of until you get to do one of these trips. Okay, and having an experienced group of people is really key to this. And that's the only thing I would say is try not to freestyle this. Don't try to do this by yourself and contacting a local surgeon. You will come unstuck. You will find it challenging. And I'm not sure what the legalities of also what your insurance claims are. If you go through a charity, it's much easier to go out through your MPS or MDU registration. But if you don't do that, you might not be covered for the work that you do out there as well. So there's that consideration as well. But I've got friends of mine who've been going out to countries all around the world at a very early stage in their training, and I used to look at their stories and their images, and they've made lifelong friends, both consultant level, but also local surgeons who they've supported, and they get to know what those individuals can do. They get training during that time. They get to do stuff under supervision. So there's not too dissimilar to what you would get if you were being trained here, but you have to go with a mentor or a consultant who ideally has done it before.
Thank you. It's interesting to hear your insights on that as well. I was just going to ask one final question about working in Sierra Leone. Have you been able to follow up with the project and see how it's being going on since you left, and whether there's been any further progress or further trips out to Sierra Leone post your trip.
Thanks, Denise. Yeah, so Sierra Leone, they don't have any plastic surgeons, so they rely on overseas doctors, not only to come and train locals, and I think that's going to change because they've charitable organizations have funded local medical students with the caveat of, we will pay for your training, but you have to work in the country for a minimum of 4 or 5 years. So there are going to be their own homegrown plastic surgeons in the near future. But until then, and it may have already happened, I'm not entirely sure. But until then, they rely on overseas teams. So the week after us, there was a team that was arriving from Italy. And then a few weeks after that, there was another British surgeon who was a burns expert going out there to do some education and teaching. So there's that continuity from that point of view. And anyone that needs further input, there will always be medically trained individuals coming to their hospital to provide a service to their population. So this Sierra Leone group that I was part of, we tried not to get too many messages across. So there was one spokesperson, and that was the person who organized the trip. And he may ask our opinion as a group, what would you do in this situation? And we would offer our advice, but so that they would get a consistent information coming from us. There'll be only one person who'll be the point of contact. And the charity, additional charity who was funding a lot of the other trips, they were also point of contact, and they would contact the people who had gone out to Sierra Leone and ask for their opinion and advice. And sometimes some of the nursing staff who had our contact details, they would contact us and ask for advice. So there was that open communication that probably still happens, more so with the project lead than maybe when I was a trainee at the time. I wouldn't be getting those direct communications. But I would very much encourage everybody to do this. It really gives you insight into how privileged we are. It's very rewarding. You get to make really good friends during that trip as well. And I remember through that, there was potential opportunities for jobs in the future as well, because people got to know me and they said, oh, we got on well with David during that time, and it would be a nice guy to work with. And that sort of thing is also important for your futures as well. I certainly would like to do this again. And the timings have to be right for the individual as well as the organization to be able to support you. But I think just to finish off on this, don't be disheartened if you don't get your BSSH or your BFirst application being approved. Okay, just keep on asking, and there are lots of people out there. I think the BSSH organizes overseas meeting once a year. That way you get to meet people that go to these, have done these trips before. You introduce yourself, you sort of state what you would like to gain from that time. Okay, there are individual surgeons like Donald Samet. He's a big guy on the hand surgery scene. He's been out in Nepal several times. So even though organizations said that, but just go with somebody who's done it before. That's all I can advise. Yeah.
Thank you.
Thank you so much, Mr. Izadi, for your time and such an insightful experience. We really appreciate it.